Section number 1, Bacteria. In this section, we will learn about Mycobacteria. Mycobacteria are the aerobic bacteria which needs oxygen for their survival. These are also the acid fast. Why these are acid fast, we will discuss later on in this video. The morphology of this bacteria is bacilli, which is rod shaped. There is one exception that nocardia asteroids is also weakly acid fast and can cause nocardiosis. So why these are acid fast? Due to the two reasons. Because in their gram staining test, they retain the carbonyl fusion staining, and in the cell wall there is the special capsule which is made up of mycolic acid, which property make them acid fast. Note that mycolic acid is made up of the lipid content 60%, which makes the cell wall thick and the acid fast. The major pathogens includes Mycobacterium tuberculosis and Mycobacterium leprae. Tuberculosis causes TB in the lungs, and Mycobacterium leprae cause skin infection and the nerves infection. In the section 1 of bacteria, Mycobacteria family, today we will discuss Mycobacterium tuberculosis. Mycobacterium tuberculosis. It is acid-fast bacilli. It can be cultured on Loewenstein-Janssen medium, means the growth can be achieved in laboratory, while the other strain like Mycobacterium leprae cannot be cultured. The transmission occurs through respiratory droplets. The main site of infection of this bacteria is lungs, and the primary immune response initiated by macrophage. The reservoirs are humans and can spread the disease through cough. The pathogenesis includes that there is the initiation of granuloma formation supported by the immune response of macrophage, interleukin 1, 2 and tumor necrosis factor alpha. Granuloma then converted into the gonfocus, which is the fibrocaseous necrosis of the lower lobes of the lung. At this stage, the tuberculosis disease can also known as primary TB. Clinical findings. The main clinical findings, common one can include fever, fatigue, night sweats and weight loss. And in pulmonary tuberculosis, when the main site of infection are the lungs, so there would be the lung associated symptoms such as shortness of breath, coughing up of the sputum color may be yellow and green, and hemoptysis, which is the coughing up of the blood. And in the simple x-ray findings, we can find the infiltrate in the upper lobe, with not forgetting that the TB can also be spread hematogeneously to the other organs. So the symptoms may can also be organ related. Miliary TB. What is miliary TB? When the tuberculotic infection starts spreading hematogeneously to the other organs. Now we will see which kind of organs or systems it can affect. When the infection of the tuberculosis go to the lymph nodes, it can cause cervical lymphadenitis, the swelling of the lymph nodes, also called the cervical scrofula. When it goes to the heart, it can cause the constructive type of pericarditis. It can goes to liver and cause hepatitis also. It can goes to the kidneys and cause pyelonephritis. Then the patients may see the symptoms of pyuria, pus in the urine. And it can goes to the adrenal gland and cause the Addison's disease, which is the adrenal insufficiency. And it can goes to the vertebra and cause the Pott's disease or Pott's spine, which is the spinal tuberculosis. And it can also goes to the bones and cause osteomyelitis. The diagnosis of the tuberculosis infection caused by Mycobacterium tuberculosis includes chest x-ray. We will see the infiltrate in the lower and upper lobe of the lung and the fibrocaseous necrosis. And the sputum test in the laboratory, complete blood count, tuberculin skin test. And the treatment regime includes the therapy may be give of these drugs includes rifampicin, isoniazid, pyrazinamide, ethambutol and streptomycin.